For this video, I will be talking about the food insecurities and how it affects low-income families. Food insecurity presents a significant problem for families with lower income because it causes adverse outcomes for physical wellness as well as child development and school achievements. This research evaluates the relationship between food insecurity among those vulnerable audiences together with proposed interventions to tackle the problem, improving family well-being and providing vulnerable groups with regular access to nutritious food stands as an essential issue for the present times. Slide number 2, food insecurity affects millions of families with special concern for the families living in low-income communities. The condition creates many health problems that reduce nutrition well-being as well as prevents educational advancements. Numerous food assistance programs operate, yet problems regarding accessibility and funding and failed policies continue to prevent people from getting help. The crisis grows worse because food prices continue to rise while wages stay constant. Knowledge about existing obstacles together with evaluation of successful solution remains essential to fight food insecurities during short and long-term durations. Hypothesis. The research aims to discover the most appropriate methods which combat food insecurity. The combination effect of government aid interventions together with community-led programs demonstrates the great potential for reducing food shortages among families with low income. This research investigates which implementation of these methods yield substantial outcomes when combined with each other. The evaluation process is used to create practical suggestions which enhance food accessibility and support structures intended for variable communities. Previously conducted research confirms that food banks, together with government support and community-driven measures, help decrease food insecurity to evaluate the long-term inequity. All levels, beginning from the individual household and moving to the community level and reaching national policies, influence the outcomes. The research community requires additional investigations to clarify the impacts of current solutions on poverty levels along with mental health conditions and mobility restrictions. Slide number 6. The research utilizes Maslow's hierarchy of needs framework because it identifies food as one of the vital elements of human survival. According to Maslow's theory, people need food security to pursue their educational or self-actualization goals. This research follows social justice theory, which works to provide fair food distribution systems for ensuring constant access to nutritious food for variable at-risk populations. Slide number 7. The qualitative research analysis will use Nouveau software to identify common patterns about food insecurity alongside intervention approaches. The study will quantify 3 main variables which include home income levels alongside food programs availability and meal supply frequency. Descriptive statistics together with correlation analysis will help explain existing connections between food insecurity with social economic indicators to generate a full picture of the solution. Slide number 8. Research data will come from qualitative and investigations which involve conducting interviews with low-income families while also holding focus groups with social workers involved in the scenario. The chosen method will generate detailed insight about personal life stories of food insecurity victims. The selection method, the selection research method enables an in-depth investigation of family obstacles because they produce information that quantitative methods alone cannot discover. The knowledge acquired through discussion directs the development of recommendations for better policy and intervention procedures. We're going to identify the effectiveness of food programs, support policy creation and resource distribution, enhance social work practices, and address food access gaps. Slide number 9. This research study generates essential knowledge about successful food assistance systems, which enables officials to create enhanced strategies for food security interventions. The community organization. The study will aid in developing persistent solutions throughout identifying significant programs because it identifies solutions that combat food insecurity core factors, including economic disparities and systemic obstacles. Consider cultural dietary preference in food assistance, economic disparities affecting different access, and addressing systemic inequalities. Also, we must advocate for equity-based policies. Slide number 10. Food insecurity requires assessments throughout culture as well as diverse perspectives. Food assistance program needs to serve diverse culture requirements of dietary food choices for their clients. Social class together with racial and ethnic factors combine to produce unequal food access across the population. The food inequities in society generate food insecurity mostly among marginalized populations. Social policies must unite two goals through their creation. They must support fairness while eliminating the organizational obstacles that block low-income families from receiving nutritious food. We must maintain anonymity and confidentiality and follow NASW ethical standards and have an ethical approach to data collection. Slide number 11. The study will maintain ethical practice throughout procedures, including participation, consent approval alongside confidentiality measures and protection of participation rights. The study participants will understand the research purpose and maintain their right to leave there at their convenience. The research team will use data anonymization to safeguard participation privacy. The research adheres to NAWS Code of Ethics standards that protect social justice while honoring clients' dignity alongside vulnerable populations' welfare for this special study. We're also going to expand government-funded food programs, develop community-based food distribution, and reform policies to address economic gaps. In addition to this, we will launch nutritional education campaigns. This study proposes expanding food programs funded by the government while developing, strengthening community-based systems for food delivery. The government should implement policies to remedy economic factors behind food insecurity and enhance food availability throughout communities. Public awareness campaigns regarding nutrition must be developed to teach people about healthy eating and available eating resources. These suggestions are designed to establish stronger food supply system which guarantees national food access to all families without discrimination. Thank you, and this is the end of my presentation.